If you've ever felt that knot of dread building before an eye appointment, then this is for you. We are about to pull back the curtain on the entire glaucoma workup, step by step, so we can turn that anxiety into some real, predictable confidence.
You know, this quote from our source material just hits the nail on the head, doesn't it? It's not always the tests themselves that get to us. It's the unknown, that quiet shuffle from one dark room to the next that really builds up the tension.
And in that silence, this is exactly what's running through your head. You're trying so hard to be the good patient, but inside, your brain is just screaming, "Did I do that right? Was I supposed to see that little flash of light?" Let me tell you, that feeling is completely and totally normal.
But what if you had the script? You know, what if you knew exactly what was coming next, and more importantly, why it was happening? Well, that's exactly what we're going to give you. A clear plan to replace all that uncertainty with a predictable roadmap.
So first, let's just get this out of the way. This fear is not some kind of personal failing. Not at all. It is a perfectly normal reaction to a pretty complex process that, let's be honest, often doesn't get explained until you're already in the chair with your chin on the rest.
Okay, so how do we combat that feeling? It all starts with a little prep. This is your 5-minute prep plan. And trust me, just a few minutes of thinking ahead can prevent most of the hassle and surprises. This is how you walk in feeling prepared, not panicked.
And look how simple these are. First, just plan for 90 minutes. That way you're not constantly checking the clock and feeling rushed. Second, bring your medication list, or hey, just snap a photo of the bottles on your phone, and absolutely definitely bring sunglasses. You do not want to be that squinting vampire walking out into the bright noon sun after getting dilated. Also, skipping caffeine can help reduce jitters for those tests that need a lot of focus, and wearing layers you can easily take off just makes leaning into all that equipment way less awkward. Simple stuff, but so effective.
All right, prep is done. You're in the office. Now what? Let's start decoding the key tests. We're going to walk through them in the order they usually happen, so you know exactly what to expect at every turn.
Ah, yes, the infamous air puff test, the jump scare of the eye exam. The biggest thing to remember here is that this one pressure reading, it's just one piece of the puzzle. It is not the whole diagnosis. And here's a fantastic pro tip from the source. Try to gently exhale during the puff. If you hold your breath, you tend to clench up, and that can actually throw off the reading a bit.
And now, for the main event of anxiety for so many people, the visual field test. This quote just perfectly captures that feeling, right? Sitting in the dark, clicking a little button, and just hoping you're getting it right. This test is designed to map out your peripheral vision, and because of that, it's super sensitive to things like fatigue and anxiety.
But this is where you can really take back some control. First, and this is so important, blink normally. Don't try to be a hero and stare until your eyes water, because dry eyes can actually make you miss signals you would have otherwise seen. Second, if they offer you a 30-second break between testing each eye, take it. It's a lifesaver for your focus. And finally, try to resist that natural urge to hunt for the lights. Your only job is to lock your gaze on that center target and click when you see something in the periphery. That's it.
Next up is often the OCT scan. This one feels super high-tech, and, well, it is. It's taking a microscopic measurement of the layers of tissue in your retina. But here's the key. If you hear the word thinning, please take a breath. That very first scan is just a baseline. It's a starting point. It's the trend over time that tells the real story, not a single snapshot.
Okay, so this slide right here, this might be the most important distinction to get. Think of it like this. The visual field test, the video game one, measures function. It's about what your eyes can actually do, how you see. The OCT scan measures structure. It's about what the physical tissue looks like. A doctor needs both of those pieces, function and structure, to see the complete picture.
All right, deep breath. The tests are all done. Now comes the most critical part of the whole visit, the conversation, where all that data gets translated into an actual plan. This is where you shift from being just a test taker to being a true collaborator in your own care.
So the doctor starts talking, and your brain can just go into overdrive. You might hear these really heavy clinical words like glaucoma suspect, or damage, or progression. And yeah, they feel like a final verdict, but try to think of them more like sorting tools. They're just categories that help the doctor figure out the next logical step.
And when it all boils down, the conversation usually heads down one of two main paths. Path one is basically, let's monitor this first. This happens a lot with borderline results, or when the doctor just wants a cleaner baseline to compare against later. Path 2 is, let's treat now. This is for cases with more clear-cut signs, like consistently high pressure. Just knowing these are the two main options helps you follow the doctor's logic.
So, we've covered the prep, we've walked through the tests, and we've navigated the big talk with the doctor. Now, let's put it all together into a simple, powerful action plan that you can use to navigate your own appointment with total confidence.
And here it is, the entire journey mapped out from start to finish. Just seeing the flow like this with the approximate times for each step can dramatically lower your anxiety. It goes from being a mystery to being a predictable sequence. Check-in, pressure check, structure tests, function test, and finally, the plan.
And this is your secret weapon, your 60-second calm script. 5 simple questions for 5 key moments. At check-in, will I be dilated today? So you can plan your day. Before the visual field, can you just remind me, center target, blink normally? A quick reset. After the OCT scan, is this a baseline or a comparison scan? To give you context. And in that final talk, what are we doing next and why? And when do we recheck this? This simple script puts you right in the driver's seat.
We'll leave you with this final thought. This one question might be the most powerful one you can ask your doctor. It takes the conversation from them just giving you instructions to you having a real collaborative discussion. It helps you understand their thinking process and what data point truly matters most in your specific case. It turns a monologue into a dialogue, and really, that's the ultimate goal.